7-year-old Bryson Overbo shows his little brother Grayson the lay of the land at the playground. When he was 16 months old, his health scare started.
And after he got sick, it was like 5 days later, he woke up and he was starting to scream all day. Just started having these terrible meltdowns. Couldn't figure out what was going on.
His mother, Ashley Lux, told me it took 2.5 years until Bryson was diagnosed with PANDAS, a condition that falls under the PANS umbrella. She and her 3 kids make chalk drawings about PANS and PANDAS Awareness Day. So what is it?
So we have all these symptoms of PANS, which vary from very seriously OCD, obsessive compulsive disorder, restrictive eating, anxiety, and we can have other symptoms like aggression and rage, handwriting changes, urinary frequency, behavioral aggression, and tics.
Gabriella True is a PANS advocate and a PANS parent.
So we can have this whole gamut of what seemed like very dissimilar symptoms, but it's where it's happening in the brain, where this inflammation is not allowing the brain to communicate correctly.
My 1-year-old baby was pretty much, he was gone. More symptoms came, frequent urination by, 19 months. We have seen endocrinology. He was diagnosed with lots of different things, multiple different specialists, and the picture never fit.
Doctors admitted Bryson to the hospital when he was 4. Someone outside the hospital told Ashley it could be PANS, Pediatric Acute Neuropsychiatric Syndrome, and PANDAS, which is PANS associated specifically with a streptococcus infection. She asked for a strep test for her son in the hospital. She says the hospital refused. They left, and another physician agreed. Bryson was positive for strep.
And it was explained to me, that it was an autoimmune reaction, and it went to the brain. And I sat in that room, and as a mother, and I had this happen to me, it flipped my life upside down.
Research into long COVID put PANS on mainstream doctors' radar, according to pediatrician Dr. Courtney West. She says the research dollars are now being spent on how viruses affect the brain. She says autoimmune conditions are increasing.
Since PANDAS or PANS is an autoimmune condition, I think its prevalence is also increasing. So what I've noticed in the field is that once a pediatrician has a patient that responds well to treatment, then they're very aware of the diagnosis and they start to see it in other patients as well. So I think the awareness is spreading, slower than I would like, but it's getting there.
While Bryson's last 2 years have not been easy, he's doing better, playing t-ball and being a kid. His mom says treating his strep infection helped a lot.
A lot of these cases of behavioral problems can be caused by strep. So if there's a strep infection and we treat with antibiotics, I would say a lot of these kids get significantly better just by treating with antibiotics and anti-inflammatories like ibuprofen.
Ashley says online support groups help her, and now she lends her support to other PANS and PANDAS parents.
Healing can happen. I have a great support. The PANDAS families have been more support to me than most, and I do have, great people in my son's life that are here to support us. It does happen. I have gotten so much better with accepting, and I have the truth. I always said I never cared what it was. I just wanted the answers. He deserved that.
This is complex and every child is different. We put a couple of important links on WTAE.com. One for parents who suspect PANS or PANDAS could be impacting their child, and another one for physicians who want to learn more about diagnosing and treating it. Dr. West says if you aren't satisfied with what your pediatrician says, don't give up, and those websites are a good place to start.